As I said before the break, we are proud to partner with American Senior Communities. Today we're going to talk about Hillcrest Village, and we are going to talk about physical therapy with two experts in the field. I have with me now Travis Princess, who is a physical therapist, occupational therapist,
yes,
correct?
Sir. Occupational therapy.
And Brandon Davis has
sir.
rejoined us again, and he is a physical therapist. Okay, occupational therapist. When I think of that, I think daily functioning. Is that pretty much it?
Yes, we usually deal in the field of functional independence. That's our goal, is to make a patient functionally independent despite whatever impairment they have. We want them to be able to thrive despite that impairment. So we actually use activities that they normally use, such as, walking, sweeping, doing laundry, in order to help them become independent.
Yeah, to live a happy life and be 100% functional, right?
Right.
All right, and I know at Hillcrest Village, is this your specialty there, Brandon? Is this something, I know that a lot of the different entities or a lot of the different facilities for American Senior Communities specialize in something. Is this the specialty at Hillcrest?
Well, we have a lot of interventions. Okay. Like we have Travis here, occupational therapist. We also have physical therapy, and we also have speech therapy. So that's our three disciplines that we have there at Hillcrest Village.
All right. Now I am curious because I see the Basu ball.
Yes.
And I use this, and I have a home gym, and I use it in my home gym for a number of things. Balance and push-ups and all this stuff. But for you guys, it's more about making sure that we're getting stronger, that we can function. So tell me a little bit about who would benefit from this kind of therapy. Who would be the patients you'd look to?
It would be a vast variety of patients, maybe someone who's just had a knee surgery, hip surgery, to work on certain things such as balance, core stability, and just overall safety and strengthening.
Strength, and also they're very tied closely with the cognitive, aren't they? I mean, you do physical, the cognitive kind of follows along, or vice versa, right?
Yes, they can do a lot of tasks on this just to keep their self-aware and have alertness and just have good safety.
So sometimes I would guess, and Brandon, maybe you can tell me, it's not those maybe who need physical therapy because of a surgery. Maybe it's getting ahead of something and make sure that we keep knees, hips strong, correct?
Yeah, and a lot of tools we use it for balance as well. So we can get on there. The way it is set up right now, it's more stable there, so we can work on somebody that's lower level balance patient, and we get a higher level patient that really wants to test a balance, and we can flip it over and work on the other side. So work on their balance just with their eyes open. We can also do eyes closed. So to really work on proprioceptive.
Wow, that sounds like pretty challenging. So if you would, show me a little bit about what you can do or what you guys do.
Yep.
So we're going to put both you guys to work again. We've got Travis, we've got Brandon here. And and this, I would think you could recommend these exercises for folks at home, right? And you don't have to be a senior, right?
Yes, anybody could benefit from this because everybody has, at some point in time, you have some deficit that you need to get stronger with. So anyone could do this, but we prefer that they come to us and we can help them out more.
There we go. All right, Travis, so what are we doing here?
All right, right now I'll let Brandon explain. I'm just going to...
First off here, the stable platform here, we're working on some hand-eye coordination here, kind of maintaining the balance.
This is the multitasking that comes in.
I see now Basu ball is that it has a lot of give in it, so you do have to keep your balance.
You do have to keep your balance here. This side is actually easier to do here on this side. We can also work on some overhead stuff.
Yep.
Wow, you're pretty good at this. That's not as easy as it looks.
Now we'll flip it over and work on the other stuff. So BOSU stands for both sides up. So this side is a lot harder to do.
Ooh, there we go. Ooh, yeah. Yeah, that has a little bit more leeway on both ends of it. Yeah, I got you.
Yep.
Okay.
All right, so kind of the same thing, but this would be more for a patient that maybe he's progressed. And maybe he's needs a little more challenge. And so we would flip it over and set his goals towards this.
Okay, and I would think if someone's had maybe a knee replacement or something, you hit a point where probably, I know at first it wouldn't be this severe, but you probably can get with the Basu ball later to make sure you have 100% functionality.
Yes, that's key. We also have a machine at our facility. It's called Core Balance, and it kind of does the same thing, except it gives us an actual measurement and readout. So it gives us like statistics so we can track how well the patient is doing.
All right, put him to work, man. I'm telling you.
All right, let's put him to work.
He's too good at this. It's upsetting me.
He is. All right, we're just going to do the simple thing, some squats and thrust up.
Wow, you see, that's impressive because, that's not an average everyday squat. It's what it's doing is really challenging your stability, isn't it?
Yes.
And then your core gets involved, too.
Yes, all the muscles that you don't even think about using, your stability muscles, all those are being fired up and used.
We've got to do something for you, Travis, because you're lacking muscle. What can we do with you? Oh, my goodness. Whatever he's doing, it's working, man. I want a glass of whatever you're drinking. Okay. Nice, Brandon. Right. Very nice.
All right, we'll do one more thing. We'll do his challenge to all his patients. Is just the 1 foot.
Ooh, now I would never even attempt that. And I consider myself, ooh, very nice.
That's why he can train his patients. He's good.
Yeah, that's exactly right. You got to be able to not just talk the talk, you got to walk the walk
That's
as
right.
well. Okay, for those who are watching, perhaps they do have a senior loved one who's starting to have trouble getting around the home. They can do some of this at home, but if it gets to the point where they need professional help, how do they make an appointment with Hillcrest Village and take a look-see at your facilities?
Well, if they call us up, if they get a doctor's order, they can come in, they can become one of our outpatients, and at the end we can come in and find out what is their deficit. We'll come up with a goal for them. We'll come up with a plan.
All right.
And try to make sure we can reach their goals.
Well, I thank you all for showing me this. Now, what's in this little guy? I'm just curious.
This is one of our interventions that we offer for pain management. This is the NPS. It's called the Dolphin because of the sound that it makes. And basically what it does is it sends a microcurrent, a direct current to trigger points. Kind of goes along the lines of acupuncture. So it is a drug-free alternative to pain relief.
Oh, I like the sound of drug-free. We hear so many things about opioids and painkillers and how they're addictive. Not the Dolphin, right?
Right.
So now I'm going to do something. I'm going to test you guys, okay? I bet you, when you say Dolphin, first thing I think, Flipper. Do you all know who Flipper is? You're too young.
Yes, we know who Flipper is.
Okay, got it. All right. Gotcha. Hillcrest Village. All right, so let's put the information up on the screen. You guys are fantastic. Brandon, Travis, thank you so much. There's the info. As I said, if you just want to take a look-see, it's right across the river in Jeffersonville. And I've been to the facility before. There's a nice family vibe there. You've got professionals like Brandon and Travis to take care of your senior loved one. And, yeah, make an appointment today. Take a look around. Bobby Johnson will take care of you. She won't come on the show with me anymore. I don't know what it is. She doesn't love me. But these guys do, so we're all good. Anyway, once again, Hillcrest Village, part of the American Senior Communities. They're under that umbrella. So thank you so much. Guys, thank you.
All right, thank you. Thanks for having us.
Learn something new every day. All right, coming up here, we're going to put a bow on this show. Thank you so much for joining us. It is the Thursday edition of Wave 3 Listens Live.